Life for the past year has been an uphill climb to clear medical debt for Jason and Deanne Dean.
The moral of this story is that you have to be prepared to walk into a hospital.
Jason injured his knee last May. He went to a local hospital where he says he was told he'd need stitches. The cost of his care should have been posted online under the federal hospital price transparency rule. Jason hadn't heard of it. He says he was told his insurance would cover everything. Weeks later, a bill came for $6,500.
And what was your reaction seeing that?
I thought it was a joke.
Insurance covered some of it, but left Jason owing more than $3,000.
Hospitals have been able to keep patients in the dark.
Cynthia Fisher, founder of PatientRightsAdvocate.org, is on a mission to stop scenarios like Jason's.
Nowhere else in our economy do we not get prices in advance of purchase.
The hospital price transparency rule, born as part of the Affordable Care Act, took effect in January of 2021. Presidents Obama, Trump, and Biden have all openly supported it. It requires health systems to publicly post the cost of their items and services online, standard charges, and also by health insurance plan, showing patients what they can expect to pay, giving them power to shop and compare.
How dramatic could the result be?
Oh, it's huge. It's absolutely huge. That unleashes competition. It unleashes a market.
But a recent report from Fisher's group, based on a study of 1,000 hospitals, found a year in only 14% of U.S. hospitals were complying with the rule.
Roughly 85% of hospitals are non-compliant.
That is correct.
When asked to respond to Fisher's report, the American Hospital Association said it supports price transparency and believes patients deserve the best possible information. The Federal Department of Health and Human Services enforces the rule and can fine hospitals up to $5,000 a day for being in violation.
We will do robust enforcement.
HHS Secretary Javier Becerra promised accountability for hospitals at his confirmation.
The buck stops with you. You're the secretary. Have you issued any fines?
We have issued several hundred warnings. We have to go through the process.
I think a lot of people's complaint is that this is a federal law, but it has no teeth.
Well, remember, those teeth just grew out.
No fines issued yet. Becerra says he needs the public's help to get non-compliant hospitals to follow the rules, helping people like the deans make informed decisions.
Can you assure those people that in the future there is going to be a different way of doing things?
There already is a different way of doing things. We just have to accelerate it so everyone knows it. There's got to be a new sheriff in town.
And you're telling them you're the new sheriff?
Well, if I can implement this the right way, then I'll walk into Dodge and try to do something about it.
Hi, Neo. Until then, Americans' right to know the cost of their care before they receive it remains a law largely ignored. Katie Beck, NBC News, Washington.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.